Greetings, Ohio Valley. This is Dan Lima with OSU Extension from Belmont County.
And this is Karen Cox from WVU Extension in Ohio County. Thanks for tuning in to Extension Calling, your source for research-based information for the farm, garden, and home.
I wanted to talk a little bit about a problem that we see in the springtime, and that's calf scours. It's important to remember that calves die from scours as a result of dehydration, and that when one calf gets it, that calf is then spreading it to all of the other animals in the field. So you do need to do your best to separate them from the rest of the herd. Or actually to leave them where they are and move the rest of the herd away, because that soil is also contaminated. But it's really important to remember that it's dehydration. Just like if you have a diarrheal infection, you need to hydrate, and dehydration is the number one problem in humans. It's the same in your animals. So you want to make sure that you are providing extra fluids for those animals. So in addition to the milk that they're getting, you also need to give them an electrolyte solution, making sure that you are increasing that fluid.
Yeah, and you know, electrolytes, they don't necessarily have to be dissolved into the water supply itself, but just having that mineral available does give them electrolytes as well. So having mineral supplementation is really important. Something that we always minerals do a lot. There's a lot of good things that can come from minerals. We talked about using minerals just in today's show as a way to mitigate or avoid both grass tetany and scours. So it's it's an investment. It costs money, but you know what? The consequences of not having that mineral available could be much greater.
All right, and just so you know, the amount of electrolytes you want to give is you want to give about 2 gallons of electrolytes plus their milk, and that's for a calf with minimum dehydration. The trick is to get to the animals early. If you can get to them early before they're down, you want to make sure that, or you can avoid doing an antibiotic treatment. And so in a lot of cases, the antibiotics aren't needed. It's just getting them past that dehydration stage and getting them back up on their feet, getting them moving around and healthy again. A lot of times a good healthy calf can recover if you catch it early enough. But there are in some cases that antibiotics are needed. But it's not really what you want to reach for as your first option, or maybe not even your second option. Fluids. Make sure you are giving those calves additional fluids and that you are separating them from the herd. One of the things that Dr. Alley talked about in the Ag Dinner earlier this year was that when you are calving, having divided pastures that you move the herd to as calving occurs. So this week's calves stay in pasture A, you move the herd to pasture B, leaving the moms with their babies in pasture A. Pasture B, next week, calves come down, you move the whole herd away from where those calves are, and that can also reduce the potential for infection and spread of scours. And we really want to do this because over the lifetime of that calf, it will gain less in the long run if it experiences scours as a calf. So we really want to make sure that we're providing a healthy animal, and we're giving it the best opportunity for gain. And also it's going to reduce your stress, the cow's stress, and the calf's stress if we can just prevent scours from spreading if it does occur. So just a quick recap of the variety of transition routes for the purpose of biological risk management. Dan, why don't you give us information on those 5 main routes?
Okay. All right. So we're talking about spreading diseases in the herd here. Aerosol. So when a cow sneezes or coughs, that's one way that they can kind of spread it to each other. So if you do have them all together and they're congregating, they're all sneezing on each other. Yeah, spreading the scours. Direct contact, feed trough, water trough. It's just good management practices to keep them separate, keep the diseased animals away from the animals that are healthy. Fomite, so objects, buckets, boots, vehicles, etc. If you're going from the diseased area into the clean area, you've just made the clean area dirty. So try to avoid doing that and go the opposite way when possible, or have specialized boots for that designated dirty area.
Yeah, and speaking of those types of transmissions, if you are using the same pitchfork for manure handling and hay handling, you're doing it wrong. Don't try to clean your pitchfork between handling manure and hay. Don't try to do the hay first and the manure second, because that manure is still going to be on the fork from the day before. Get yourself another pitchfork. They're not terribly expensive. Save yourself the potential disease transmission opportunity.
Yeah, really good advice there. It's stuff that we overlook. There are just things we do day to day and don't think about. But if you have this stuff in the back of your mind, which is one of the reasons why we do shows like this and talk about stuff going on, is so that when you step out there, now you have it in your mind and maybe you can catch it early on. Yeah, real simple solution there. So buckets, boots, vehicles, pitchforks, etc. Watch that. Oral, by mouth. Again, if you got livestock congregating, they're all over each other.
And dairy cows are the worst for that. They have some very curious tongues. They're always licking everything and including each other. So make sure that you are watching your animals. And if there is one that is showing signs or symptoms of any kind of disease, that you are getting them separated from the herd.
And then I'm going to say this is vector-borne diseases. So when you have insects transmitting diseases, so if you have a high instance of anaplasmosis or flies, it just kind of goes to show you can prevent the transmission of other things by taking care of flies and ticks and just the general stuff that we grubs in the livestock. These things can jump from one animal to the other. So mitigating that as well as a potential vector type transmission route is going to do you wonders. And zoonotic. So this is spreading from animals to humans through one of the 5 previously listed routes. So not only do you want to go from clean to dirty, you want to make sure you clean yourself up as well when you're going back to your clean cows. They're all a little bit different, but they all highlight the same message here, and that's just good management practice for disease isolation. So you want to keep things separate, keep things clean, consult your vet, and do what you can to mitigate problems early on before there are problems, because it's a lot cheaper to prevent something than it is to cure it.
Yeah, and when we're talking calf health or the health of any infant, we're talking about making sure that infant has colostrum, be it a goat, a human, a cow, it doesn't matter. If it's a mammal, it needs that colostrum. And colostrum is different from milk. Colostrum has a lot more antibodies in it than milk does. And basically what it does is it is a weird vector that allows the mom to pass her immune system on to her calf or her child. And it's really, really, really important that that calf or that baby starts nursing and gets a lot of colostrum in it within that first 24 to 48 hour period. The first 24 hours is critical, and you don't want to lose that colostrum. So if that calf is having trouble nursing, you really need to get in there and get it a colostrum supplement. And watch your genetics too. If your mama cow is not a good nurser or her teats aren't right, that cow needs to be removed from the herd, because if she can't get that colostrum to those babies, then she's not doing her job. And if she is not physically able to, then she's going to pass those genetics on, and you don't want that in your herd.
Yeah, and I'm just going to say something that's going to complement what you said there about the udders and nursing. A lot of times when we, even in the research farm in Caldwell over in the Ohio side, when we're talking about culling cows, one of the things that we look at is there's always a disposition, right? The cow's not calving, but let's say the cow is calving, but the udders are just too big, or they've had issues in the past. Last year this cow didn't have a good calf, and we had to bottle feed it, and this year we're having the same problems. That's not something that you really want to be involved with day in and day out. So if you're having these issues, or if that udder's already messed up from mastitis or whatever issues that happen, maybe it's time to call that cow and not invest that money into that cow, even though it's producing a calf. If you think about the time investment and the money investment and getting that cow to nurse, like Karen was saying, if that cow isn't healthy and stress-free, one, it's not going to gain that much. It's going to cost you money. It's going to cost you money when you sell it. It's going to cost you money just to be able to keep it alive so that you can sell it. And overall, you're going to probably go in the red because something simple as that cow's udder isn't suited for good nursing, or that cow's disposition just she doesn't want anything to do with her calf. Or last year, maybe the year before that, even if you're really patient. So look at those things and make a good financial decision on when to cull cows that have bad udders in this case.
Yeah, because that is definitely going to impact your bottom line, and it's going to impact the health of those young calves. I know she can give a really beautiful calf that's got a good size and a good frame, and the calf is really healthy. But if she cannot get colostrum and milk to that calf, she is not doing what you need her to do on the farm. All right, so another thing that we talk a lot about at this time of year is vaccinations. So we wanted to go a little bit over the different categories of vaccinations that are out there, or the labeling language. So there's 4 main categories for vaccinations. There's those that prevent infection, and that is your strongest label. A lot of people think any vaccine is going to prevent an infection, and that's simply not true. There are some vaccines that are stronger than others, and they will have that label of prevent infection. More commonly, you're going to see a vaccination that says prevention of disease, and that'll be the wording that's on the label. And really, that tells you that it has a minimum of 80% efficacy in preventing the clinical signs of that disease. It's not going to prevent the animal from contracting necessarily, but it is going to prevent the disease from manifesting within the animal for an 80% efficacy rate. I can't say that word. And also, we're going to see a lot of vaccinations out there that say they aid in disease prevention. And that means that they have a less than 80% efficacy in preventing the clinical signs of that disease. And then finally, the 4th category, which is the lowest one out there, is where it says aids in disease control. It'll decrease the severity, it might decrease the duration, or delay the disease onset, but it is not going to in any way prevent the disease. So basically, the ones that you're going to really want, prevention of infection, that's your number one, the strongest one. Prevention of disease is at 80% efficacy, and AIDS in disease prevention is less than 80%. And so you need to figure out which one works best for your herd situation. Obviously, the ones that are more strong are going to be more expensive. And so there's also the question of vaccination versus immunization versus protection. Antigens, adjuvants, antigen interference, prime boost, those are all terms that are used to describe immunization program advancements. They're not really the words that you're looking for. The words you're looking for are prevention of infection, prevention of disease, and AIDS and disease prevention.
And another good way to figure out what you need for your herd is to have that relationship with your vet. Your vet's going to be more than likely somebody local that visits several farms, knows what goes on in the area, knows what time of season certain things can happen. Also, maybe even knows potential problems from things that are unexpected. So flooding, for instance, would be one of them. Flooding, which can bring potential problems that your vet would probably give you a good answer for and say, you know what, this year I would vaccinate for X. And listen to the vet, because the vet's going to be the one that's the person that comes into contact with most problems in the county, and also the one that's going to be local and could possibly prevent you from either having that disease encroach on your farm or give your cows a better chance of coming out of it and hopefully a good weight and good health so that you can make some money in the long run. So your vet's a great source that you shouldn't overlook when you're trying to figure out a good vaccine program.
All right, and just to be clear and to go back to the really basics of it, a vaccination is the process of drawing a product out of a bottle and administering it to an animal. And we don't know if we got a response or not. The goal is to vaccinate the animals and have them respond to the product. And the best way to do that is to make sure that the animal is not stressed at the time of vaccination. Thus, you should not be vaccinating at weaning, and a lot of times you shouldn't be vaccinating until that calf is good and strong and on its feet. Definitely not in that first 24 to 48 hour period, because that calf is really stressed. Being born's hard. Let them get that colostrum in them. Sometimes you can even run into the situation where the vaccination is going to interfere with the colostrum or vice versa. The colostrum is the best immunity support that the calf can get. Let the mother get that immunity support into the calf. Don't interfere with that. And then you can look at your vaccination schedule. But really, you do not want to vaccinate anytime that calf is going to be stressed. So if they're moving from pasture to pasture, that can be mildly stressful on a young animal. If they are going from hay to grass, that is stressful on an animal, or vice versa. Anytime you are stressing an animal, it is going to reduce the efficacy of that vaccination. So even if you get a really good one that has greater than 80%, you may not be getting that greater than 80% protection in your animal because it was the wrong time to give it to that animal. There's also issues that occur when you are doubling up your vaccinations. There are some vaccinations that do not sit well with others, and one of those is the IBR, the herpes virus. Calves' immune system identifies this as very challenging, and so if you are giving that particular IBR vaccine, it's going to impact the response of other co-administered vaccines. So you want to avoid doubling that up unless you are doing two different types of vaccinations. For instance, a subcutaneous versus an oral. So that or nasal. That is the only way you can give your IBR vaccine with something else. So if you do need to get the two doses into an animal or two vaccines into an animal at one time through the chute, your BVD would be a shot versus the intranasal for your IBR. That would be an opportunity for you to double up with that particular vaccination. Once again, the IBR can be conflicting with other vaccinations.
That's really good. And let's talk about some of the better sites to do an injectable vaccination. And obviously, if it's got to be a nasal, there's only one route for that. But if you are injecting your livestock, remember that the ideal place to give vaccinations is in the neck, the back of the neck. And the reason for that is that it's, well, for intermuscular specifically, high muscle area, but not really a muscle that we use for meat consumption, so that you are potentially avoiding an infection or getting a cyst in there and ruining that good meat. And now, even though it might not be caught up front, your reputation as a feeder calf seller might be jeopardized, and you don't want that. You want to make sure that your products are good, you have a good reputation, and that you're putting a high quality beef product out in the market. And also, what Karen was saying about stress, we talk about selling your calves at the market. A lot of times, if you have stressed calves, or if you're not vaccinating, and down the road, the next buyer is going to have issues with your calves, that could potentially come back and cause you problems when you're selling your calves. So do these programs, make sure you're not stressing your animals, and understand what you need and what you might need right now, as opposed to there's routine needs, and then there's specific needs that your vet can also help you identify.
Yeah, and before I move on, I want to touch back on something Dan just said about if you're taking an unvaccinated animal to market. Now, you do also need to understand if you are vaccinating with a killed vaccine only, then once that animal is at a feedlot, it's considered to be unvaccinated. There's poor control of respiratory diseases on feedlots, and so they really do prefer you to use that modified live vaccine with your calves. So with the vaccination schedule, WVU has a vaccination schedule that we use for our calf pool program, and I'd be happy to share that with you. But there are things that you need to consider that are specific to your farm. For instance, if your farm has had an issue with blackleg, you may want to consider doing a vaccine at birth. But you have to understand the risk of doing that. If you've had a bad history of blackleg, it's a soil-borne disease, and you know it's on your farm, you can vaccinate at 1 day of age, but remember that the immune system of that calf or baby animal is immature. You're not going to get a strong response, so you want to revaccinate that animal again within 2 to 3 months. Any vaccinations you give at birth, you will have to revaccinate simply because the young animal's immune system is not yet developed. And in an ideal world, your first vaccine would be in the 2 to 3 month old window as an intranasal spray. You really want to give that calf time to develop itself. And if you don't vaccinate until after the calf is over weaning, about 1 month after that weaning stress, those calves are going to respond especially well, especially if you can get 2 doses of a modified live into them before they go on to the next stage of production at a feed yard or whatnot.
Yeah, and that's to kind of go back to the blackleg, that soil-borne disease. That might be one that when we were talking about the flooding instances being a little bit higher than usual. That is one that's soil-borne. That one does thrive when things are wet. All bacteria like warm, wet environments like that. So coming out of a flood, having a lot of ash on your forages might make it a very bad time, or however you want a bad time for that disease bad time for you, good time for that disease to occur, if that makes any sense. The chances of blackleg might be higher this year due to this flood. So that might be one. Again, consult the vet. The vet's going to give you the best advice. They're going to be the ones out there seeing the issues, knowing the history of things. And obviously there's some confidentiality there, but the vet will know if there's a certain problem in the local area. They probably won't tell you exactly where, but they could say, you know what, I've seen this around. Maybe you should vaccinate for this specific thing this year. And that's going to give you some good consultation, good relationship with your vet. Also, let's talk about things like clean water. That's always going to be a very important thing. And good minerals, high quality feed. If that animal's not stressed, we talk about stressing the calf with vaccinating too early, the colostrum providing that passive immunity as well. Just having good, clean conditions, having a low stress environment is going to go a long way in preventing these diseases that the vaccines are only going to help you on top of those good practices that you should be doing day in and day out.
Yeah, and sometimes the vaccines that are available to us may not be the very specific vaccine that we need. For example, pink eye. There are, I believe, 200 to 300 strains of pink eye in the wild, and we have vaccines to affect about 6 or 8 of them. So if we're not vaccinating against the particular strain that's in your particular field, then it's not going to be effective. So you do need to have other things in place. Vaccines are a protection net, a safety net, but what you need to do to really be managing your risk is making sure those animals have good nutrition. That gives them that ability to respond and resist these diseases, even if they are exposed to them. For instance, foot rot. Copper, selenium, and zinc, those all improve skin tissues, and they can protect the animal from these issues. Those organisms are in the soil, especially after a heavy flood year. If you have a low-lying pasture, you're going to be watching out for these kind of things. Also, if they've been in mud all winter, for your winter feed pad, you really want to watch them for foot rot and make sure that they have a good mineral supplement with copper, selenium, and zinc. And also, our soils are deficient in selenium in this area, so you do need to have a selenium to get into your cow through a mineral intake. The calf is going to absorb it through their blood in vitro, so they're going to have it from their mother. However, once they're born, you need to make sure that you are getting that selenium into all of the animals. And if you're doing vitamin injections, most of them are between 3 and 6 weeks. But again, you really need to talk to your vet before you're moving on to injections. The best way to get nutrition into an animal is through the feed, just like you and I The shot is your last resort recovery. You want to make sure that you're offering that healthy meal up front and keeping the mothers very healthy, giving them that good feed so that they can provide the best milk for the young is going to be your best safety net for both of them.
And in terms of handling livestock, we always talk about how useful a good chute is. It is a major investment, but when you are looking at a lot of just good practices, let's say you have a high number of cattle, it's a significant portion of your income. We talk about the stress factor. Think about how much potential gain you might have, how much you would lower the stress of these animals by handling them through a proper chute. And also, if the vet does come out to visit and you have a chute, that vet's going to be a lot more comfortable as well.
You don't have to invest in the most fanciest, most expensive handling chute out there, but you do have to have a good chute, and your animals have to know your chute. So run them through a couple times so that when they don't think that they're going to get a shot every time they go up to that chute, because that's going to give them that stress warning. So run them through a couple times and just let them run through without stopping them, just so they get comfortable with going over that step, and then bring them through again and close them in without a shot. Bring them through again, just so they're used to it. This is all technique to get them used to working with you, used to working with your chute. You're going to have a much better result when you do vaccinate if those calves are calm and comfortable. And I know some people use alfalfa cubes and train them just like dogs. So it all depends on what works best on your farm. I understand that you probably have another job. You're really busy. There's a lot to do on a farm. But keeping your animals calm and comfortable with you, it will go a long way to making your job and your life easier and also safer for both your animals and for you. So do look into the low stress handling techniques. Just a little wave of the arm can often be enough to move the whole herd along without having to shout, prod, or whatever. It's really simple just to get into that zone, and it's really hard to change habits too. So if you know that you have a high stress method of moving your cattle and you want to move, take little bits at a time, because it is going to be hard to change your habits, but you will be very thankful that you did, and try not to fall back into those old habits.
Yeah, and there's always moving a mineral feeder.
Thanks for listening to Extension Calling. This show is a collaboration between OSU Belmont County Extension Educator Dan Lima and WVU Ohio County Extension Agent Karen Cox. If you'd like a transcript of this show, contact us at the office. Also, let us know if you enjoy the show by ranking us on your podcast app.